evening.
Good evening.
All right. So, first of all, thank you everyone for joining us this evening. Um, I just wanted to just mention what we're here to talk about, introduce you, Dr. Saadia, and then we'll get things started, okay? So, first of all, we'll be discussing the topic of seasonal allergies. I know it's a very vast topic, but we'll try to, focus on some facts. We'll talk about some tips and talk about some myths, and you'll kind of go into a bunch of details with that.
Yeah.
So, for everybody that, just to introduce myself, my name is Dr. David Orfali. I am a family medicine doctor. I see both adults and kids. We deal with this issue all the time in seasonal allergies. I just want to introduce everybody to our guest here, Dr. Tehila Saadia, who's a board-certified pediatric and adult allergist and immunologist as well. She also has a private practice here in Brooklyn. So without further ado, thank you so much for coming on here.
Thank you for having me. Nice to see everybody on Instagram. As Dr. Orfali said, I am a pediatric and adult allergist, immunologist, and we are now heading into what looks like, full-blown spring allergy season. Now the weather finally has gotten better. So I'm here basically to tell everybody, or help everyone out how to manage symptoms, how to get themselves through the next couple of months, through this weather.
Yeah. Well, thank you so much. Thank you for dedicating your time. So let's talk about some questions that we have here, and we've kind of like assembled some pointers here to discuss. First of all, what are some of the symptoms of seasonal allergies that you typically? And I think a lot of people always kind of have this question of, is it seasonal allergies or is it sort of like a common cold, like the sniffles, like how do you differentiate between these two? And, tell us a little bit more about it. Absolutely.
So basically, to just explain what the seasonal allergies are, pretty much as with all allergies, it's this problem where the body's immune system rejects a substance that it deems dangerous, even though technically it should be harmless, and it fights this triggering substance that we call an allergen wherever it shows up. So in the springtime, so when there's pollen coming from the trees and later on grass, which happens later on early summer, when those start blowing in the wind, the allergens can come in contact with the eyes directly, which can cause itching, watering of the eyes, redness, and swelling. And when you inhale the pollen, it can be landing in the upper airways, which affects the nose and the throat. And sometimes can go even into lower areas, leading to asthma as well. And so you can get sneezing, runny nose, congestion, excessive throat clearing, and coughing because of postnasal mucus drip. And like you said, how can you distinguish it between an infectious cause, which would be like a cold virus or allergies? And the main difference really is the itching. So the way the immune system is responding to the allergen, you're going to feel what we call pruritus in medical terms, or itching, which will most commonly be either in the nasal passages. A lot of people complain of it in the throat or on the the palate inside the mouth, and you want to feel like they want to scratch out the inside of their throat, making this noise like to try and make it feel a little better, which is not very common when you have an infectious cause like a cold. People also experience itching in their ears as well. And so it's really the itching that's really the primary, distinguishing characteristic between, allergies versus, an infectious type of cold virus or something to that extent.
Sure. Yeah. Well, that makes a lot of sense. I know that as a person that suffers from seasonal allergies, I kind of like always have to do one.
Yeah, you always want to this and the throat. Yeah.
Yeah. All right. Well, thank you so much for, for that explanation. I think that helps us put things into perspective a lot.
Right.
So you spoke about these triggers, right? These triggers that can cause allergies. So I think what everybody wants to know is, how do you go about identifying what your triggers are? Is there something specific to do, or go ahead.
Okay. So the first step really is paying attention to the patterns of the symptoms. So, what's called allergic rhinitis, which is basically, inflammation of the nose, but it also can, reach more into the eyes, conjunctivitis, and further down as well. It can be classified as either perennial, year-round, or seasonal, which is particular to a certain type of year, which is what we're focusing on now, basically. The perennial ones would be things like dust, pet dander, roaches, mold spores, usually indoor allergens. And then the ones that are focused for tonight, the seasonal allergens, are usually pollens, and they have specific seasons. So in northeastern U.S. where we are, it's usually the trees that will have their pollen and their peak in the springtime. And then the grasses will then put their pollen out more towards like late spring into early summer, so extending more to like May, June, sometimes even early July. And then later on in the year and in fall, so let's say like late August into even wherever there's the first frost of the year, that will be the weed pollens.
Right.
And there's a difference also in the types of pollens and when they're even the times of day that they peak, or when you expect your symptoms to happen. So if you notice that your symptoms are worse when you walk outside in the morning time in the spring, that's most likely a pollen allergy. Whereas when it's in the fall, if you notice your symptoms are worse in the evening when you're outside, that's due to the weed allergens. So it depends on the time of the year, also time of day, and then if you notice your symptoms are year round, there may be a combination actually of pollen allergies that happen in the spring and the summer and the fall, and then you also have dust allergy happening in the wintertime. So it could definitely have a mixed picture as well. It can be very complicated.
Yeah, yeah. Well, yeah, that definitely makes a lot of sense. So let me ask you this now. Like, is it important to find out what allergens specifically somebody is allergic to, or does it not matter? Like, tell us a little bit why somebody should know.
Absolutely. Yes, it can be very, very helpful to know. So, the thing is, when you have these symptoms of the itchy, the eyes, the watery eyes, and nose symptoms, all this stuff going on, you say, I've had this my whole entire life. I can live with this, or I can take some over-the-counter meds and I'll be fine. The truth is that when you leave allergies untreated, it can seriously interfere with your quality of life. They can lead to issues with sleep disturbances, irritability, even depression, inability, to do social functioning, physical functioning, attention span, memory deficits, all these different things. And it's really good to know, what it is that you are specifically allergic to, so you can, not have to suffer from all these different issues. The other thing also is that, allergic rhinitis can also be associated with increased ear infections, as well as sinus headaches that people describe, where the blockages of the sinus openings leads to pressure in the sinuses, in the face, and the head. You can have allergic asthma as well when it affects the lower respiratory system, and even certain types of food allergies. This is where the specific pollens really come into play. So there is this entity called pollen food allergy syndrome, which not a lot of people are familiar with. It basically means that there's certain proteins that these allergens are that cross-react, very similar in structure to some proteins found in certain raw fruits, raw vegetables, nuts, seeds, and spices. And so when you actually ingest these foods, your body gets confused and thinks that you are actually ingesting the pollen. So it can lead to itching, very localized to the lips, tongue, mouth. You can get itching, swelling, and it doesn't spread systemically most of the time. Very rare to get a true systemic reaction, but you can get this localized reaction that happens as a result of this cross-reactivity between the pollen and the food that you're eating. So like, for example, birch tree pollen will cross-react with certain types of stone fruits, we call them, peaches, also apples, cherries. So people may realize they have like a little itch in their mouth and they eat these fruits, but they're fine afterwards. But what if they were to, to drink a smoothie that had one of these fruits in it? They could get themselves to serious trouble, because that could be a more severe reaction, because the amount that you're ingesting is, the volume you're ingesting is much greater than taking a bite out of the fruit, for example. So that could possibly be, lead to anaphylaxis. So you want to know exactly what your allergens are to help you avoid certain foods that you may notice that cause you even a little bit of symptoms.
Yeah, and that makes a lot of sense. Like, we do see these cross reactivities between different allergens, and
Sure.
if people are allergic to something that's in nature, they would definitely want to know about it, because if there are certain fruits, like you said, or certain foods that can cross react, that can lead to anaphylaxis, which is a severe allergic reaction.
Right. And then when you want to know exactly what your allergens are, that's visiting an allergist is very helpful for, and you can do specific tests to find out what your allergens are.
Right.
So the most common test everyone knows about, doing the skin prick test, that would involve placing the allergen extracts on the skin and observing if you develop, an itchy sort of like a bug bite type of reaction in any of those spots by the allergens, that would indicate that you're allergic to that substance. And then going from there, if you try allergy medications and you're not able to tolerate them, then, or they don't work for you, then allergy shots are really a targeted way of treating the specific allergens. So in reality, to know your allergens is really good in terms of being able to treat your allergens effectively in the long run.
Yeah, that definitely makes sense. So tell us what measures we can take to protect ourselves from pollen and some of these other allergens that we see during the season.
Absolutely. So this is probably the most important part of my talk for people who are logging on now. You didn't miss it. Doing preventative measures to prevent or minimize pollen exposure is probably the first step in making your allergies better for the season. So the most important principle here is that you don't want to invite the pollen into your house. So it's an enclosed area, especially your bedroom. You don't want any pollen in your bedroom because you're spending a good, we hope, 8 hours sleeping in the same environment, and you don't want to be breathing that in all night long. So most importantly, to keep your windows shut is the first thing, and running your air conditioner is much better. You want to make sure that anything that's exposed to the outdoors, be it hat, jacket, shoes, all the outerwear, you do not want that in your bedroom. You want to keep it as close to the door of your home as possible. Now, many, some things people don't think about. For example, people wear shaitels or wigs, or people wearing tichels, mitpachot. Those really should not be kept in your bedroom after you wear them outside because they may have pollen all over them as well. Sure. So best to find another place to store them when they're not being worn before you wash them or take care of them, whatever that you do. And so also any clothing, if you're not wearing a jacket, it's nice outside, the clothing really should go directly to the laundry. When you have kids with allergies and they tend to leave the clothing on the floor sometimes, not put directly in the hamper, got to really make sure that at this time of year, it's got to go straight into the laundry and not lay around all over the bed and the floor. And also making sure that you shower before you go to bed. Some people are more like, a morning shower person to wake them up. But it's really important to rinse off in the evening when you come home before you go to bed for sure. That way the pollen won't be lingering on your hair, the eyelashes and so forth, so that you'll be able to sleep comfortably without breathing it in all night long.
Yeah, definitely. Those are some great tips. Preventative is really always the best way to go about this.
Sure, yeah.
Now, let's say a person has allergies, seasonal allergies. They know exactly what they're allergic to. We always see these over-the-counter medicines. There are a vast array of them. There are shelves, filled with these things on, Walgreens, CVS, wherever. So the question is how do you know what to take and what's safe, what's effective? Give us a brief, lowdown of that.
Absolutely. Okay, so the first thing I'm actually going to discuss is not a medication per se. It's actually a saline rinse, which is actually really helpful for people who are hesitant to use medications or nose sprays and so forth. So it's literally just taking saline and rinsing it, through your nasal passages physically. It can really help to physically get rid of irritants, allergens, anything that can be causing the congestion or, itching inside the nose. And then that, can then have, more positive effects on everywhere else it's connected because your ears, nose, and throat are all connected to each other. So using saline rinses, I usually recommend it as first line for people who don't want to try and get over-counter meds. Also in pregnant patients who are hesitant to use any sprays, it's great to try use a saline rinse to start off. In terms of first-line therapy medications, according to the guidelines, it really is best to start off with a nasal spray. Topical medications to target exactly where the problem is are really better than systemically taking a medication that could potentially cause side effects like drowsiness or, drying up, things like causing dry eye and things like that. And so really the first line should be like a nasal spray. It could either be an intranasal steroid spray, such as Flonase. A lot of people are familiar with fluticasone. There are other ones also out there, mometasone, triamcinolone. For also pregnant patients, we really don't recommend to use triamcinolone because the question whether it can cause birth defects or not. As well as patients who have glaucoma, not such a great idea to use Flonase because it's possible that the steroid might lead to increased ocular eye, the eye pressures can go up. So there are certain, precautions, certain populations should take in using these nasal sprays, but it really is first line in terms of trying to tackle things in the beginning. If topical is not good enough, then that's where you can add in, besides for the steroids, you can also do antihistamines in the nose. There's one called azolastine, which sometimes even used in combination with the steroid nasal spray. That alone is good enough even without the medications by mouth. And also using the topical eye drops as well. If you use those, the nose and eye drops, you may not even have to take an allergy medication by mouth. Now, if someone is not comfortable using the nose spray or eye drops, they feel like it's not working for them, then you can say, let's try an oral antihistamine, which is over the counter easily. So I know, so Claritin, for example, that was, the first line for many, many years. And then at some point, I have had patients tell me it doesn't work for them anymore. So my recommendations really more are along the lines of Zyrtec or Zyzal, which is sort of like a sister medication to Zyrtec. And then Allegra also, that one has from what I understand, it has the least side effects in terms of the drowsiness. So for anyone who needs to always be alert, depending on what your work is, Allegra may be your go-to. And all these medications have both trade names and, their generic names. So if someone sees, let's say, a CVS brand or a Walgreens brand of medication, it says cetirizine, that's the same as Zyrtec. Loratadine is the same as Claritin. Fexofenadine is the equivalent of Allegra. And levocetirizine is the same as Zyzal, just so people would know. And then the other thing also, a lot of people, they think Benadryl is synonymous with treating allergies. To be honest, Benadryl crosses the blood-brain barrier. It causes extreme sedation, drowsiness, interferes with cognitive function. It's sort of like, an oxymoron. I'm the allergist that hates Benadryl. I would prefer people really use the second generation, the newer antihistamines, rather than the first generation like Benadryl because of the side effects. 100%. The other thing I forgot to mention about the nasal sprays, which a lot of people don't know, is there is a specific technique to use them effectively. So many times people will say this is not working for me, but they don't actually know how to use it properly. The key is to really aim the spray bottle towards the ear, like this way. You can take the spray bottle in your right hand, spray it to the left ear in that direction inside the nose, and you take the spray bottle in the left hand and spray it to the right nostril towards this ear. That way, you avoid the middle, the septum, which can cause nosebleeds sometimes, and you also avoid it dripping to the back of the throat, where it can taste nasty and not do anything because it's not going where it needs to. It should be in this area over here. So that is extremely important in knowing whether something is working or not working, depending on the proper technique that you're using. Now, aside from, so we talked about the nose sprays, talked about the eye drops, talked about the medications by mouth. There is another medication also, besides for antihistamines by mouth, that it's known as Singular or Montelukast. So that medication is more helpful for patients who have allergic asthma, which is asthma that is caused by allergies. There is sort of this, like black box warning for the medications, and it can lead to issues with mood or with behavior in kids. Also, there are reported headaches as well. If anyone who has a psychiatric history, it can, lead to, more like recurrence of those symptoms, of their psychiatric symptoms. So generally, Montelukast is not really recommended to be used in conjunction with antihistamines because of all these things, unless it's for allergic asthma and the patient's been on it for a while and it really helps them. There's no reason to discontinue it. But to start it in conjunction with the antihistamine, I believe studies have not really shown that it's more effective to use them in combination as opposed to an antihistamine alone, unless we're talking about allergic asthma. So, yeah.
Those are two things that we see very often with each other, is like the allergies and asthma.
Right.
Both have like some very similar underlying causes. Well, yeah, thank you so much for all those great tips. Those were excellent, and you touched up on so many things that honestly many people don't know about.
Right. Actually, I just wanted to add one more thing I forgot to mention. So how there are these that over-the-counter medications that'll have like Claritin D or Zyrtec D that has a decongestant added into it, right? So that can make the medication even more effective. It's just important to know that certain populations may not want to use those medications. For example, if someone is breastfeeding, any sort of decongestant in that category, so if it contains like pseudoephedrine, that may actually dry up their supply. So I would not recommend to use D medications in that case. And then also people who have issues with blood pressure also to be used with caution. So anything that has a decongestant added to it, always it's important to discuss it with a physician. So even though these are over the counter, it's really, really best to discuss these medications with your physician just to make sure that's the right one for you.
Yeah, well said. And you touched upon something earlier that I want to just get back to. You mentioned allergy shots. So tell us a little bit about allergy shots, how they work, and who they're really for.
Absolutely. So allergy shots really are a way of providing more of like a treatment for allergies. When we use medications, nose sprays, and all these different things, we're literally putting a band-aid on the problem. So when you're doing allergy shots, you are targeting what's really causing your symptoms and teaching your body to tolerate them. So the way they work is after you do your allergy testing and you find out what your specific allergens are, whether it's on the skin test that we measured before, or whether it's a blood test to find out what your levels of antibodies to specific allergens are, because sometimes the skin prick test doesn't work for everyone, then you figure out what the allergens are, and then you can prepare in these vials. You mix the extracts and you dilute them down to a very, very weak, to stepwise weak concentrations, and you gradually inject these extracts weekly, or you can even do it more, faster than weekly if you want to finish this faster, and you build up to a dose that's a target where you want your body to be able to tolerate it. So for example, if someone's allergic to many different types of pollens, but also they have allergies to dust or whatever it is, they're all mixed together in these vials. You provide these injections. There are different schedules depending on what guidelines you follow, but let's say after about 30 to 40 weeks of doing this buildup, then you're able to do every month you get this allergy shot, just to keep reintroducing it to the body on a regular basis to show the immune system, hey, this is something that's not dangerous, this is something I see all the time, and I shouldn't be reacting. And it's really interesting why we call this a treatment, because studies have shown that when you check for levels of the allergy antibodies called IgE, to these different types of allergens, when you start the immunotherapy, the allergy shots, compared to over time, those IgE antibodies against the specific allergens really do decrease over time. And a different type of antibody called an IgG, which indicates tolerance to the antibody, rises over time. So it's been proven that this really does, it really does cause a positive change in the immune system for the better, where you learn to tolerate these allergens that previously were causing your body to cause all these different symptoms. And so over time, usually people will report their symptoms get better, halfway through the treatment, and then the guidelines say if you do this for an average of around, let's say, 3 to 5 years, by that time you really may, your symptoms may be completely gone, or at least your quality of life has improved to an extent where you don't need to continue them anymore. And it's really an individualized case by case basis deciding how long to stay on them.
Yeah, wow, that's amazing. Yeah. Okay, and then one of the last things that I want to touch up on here is that people have said that eating raw honey during allergy season can be beneficial. Is that a thing, myth, a fact? Can you tell us a little bit more?
Yes. So this is something I actually looked into recently, since I was getting some questions about it. So I'll tell you, the reason why people think this might be helpful is because it is a thought that you're regularly exposing yourself to pollen similarly to the way allergy shots work. So if it's local honey, it's raw, it's not processed, and it's made from the plants that are near where you live, you're sort of doing the same idea as allergy shots, where you're introducing the pollens to your body, so you should be able to tolerate them. The difference really is that the allergy injections help to desensitize you by exposing you to the specific pollen or pollen mixture in exact amounts, and it's carefully calculated to know how much you're getting each time, so that you can gradually be able to tolerate a targeted amount, a targeted dose. Now, the thing with the local unprocessed honey, it does contain small amounts of pollen from the environment,
Right.
but it's mostly from the flowers where bees are found. And this is a very common misconception or myth a lot of people hear about. Where there are flowers, it doesn't mean there are allergens, because the types of pollens found in flowers are meant to be pollinated by insects. They do not blow around in the wind like the pollen from trees and grasses and weeds. So if you are going to be having some of this pollen from the flowers the bees are pollinating, it's not really going to be the pollen that causes allergy symptoms, or at least it's less likely to be those allergens that we're concerned about. And so the amount of allergenic pollen in the honey is typically very small. And it would be, if it was there, it'd be considered a contaminant like bee parts or mold spores or bacteria or other environmental particles that might be in there if it's not processed.
Right.
And when you process it, basically, like, those things are usually removed.
Right.
And there's really no scientific proof that if you eat local honey that it will really improve seasonal allergies. There are conflicting studies. There was one done, I don't know how great the sample size was. There was one study right about that says, it was, people reported, their symptoms were better when eating the local raw honey. Another one showed there was no difference at all. So there's no real consensus, but when you think about it, you wouldn't expect it to work the same way the allergy shots do, because the type of pollen that's in there and also the amount that would in there would probably be much less, and you're not even calculating how much is in there. So basically, with another thing to think about is that in rare cases, there could potentially, theoretically, be a risk in extremely sensitive individuals that if they were to ingest the unprocessed honey, they might get an immediate allergic reaction involving the mouth, throat, or skin. Either because of the pollen or bee part contaminants, because they may have, allergy to the insect itself. So is it a good idea to have the raw honey? In most cases, it won't hurt. I'm sure it's delicious. I'm sure, you'll get something good out of it, but will it help to prevent your allergy symptoms?
Right.
No real proof for that.
Probably not. Right. Okay. Yeah. So, first of all, thank you so much for giving us all those tips, all that information.
Sure.
Anything you want to add as we kind of close this out?
Basically, for anyone who missed the tips from earlier, most importantly, you do not want your pollen coming into your bedroom. So do everything you can to keep it out of your bedroom so it's not there when you're sleeping, whether it's showering, before you go to bed, making sure the outerwear is all not kept in your bedroom. You don't want to invite the pollen inside your house. Keep the windows shut, all those different things. And those, that really you can help, just taking those common sense measures of really being very, very, paying very careful detail to them, really may improve how you get through the allergy season.
Yeah,
for
absolutely.
Sure.
The preventative side of this is really the best way to go.
Absolutely.
Keeping the out, making sure everything is clean, change your air filters on the air.
Right.
So that that I've heard really helps as well. And those tips, I think that if you follow them, I think people do very well.
Right, and so when you do those measures, it may not take care of everything, obviously, and that's where the medications comes in. And that's also where the allergy shots come in, because people can do their best, and no matter what they do, they may be suffering from the asthma part of it, or the food part of it, the pollen food allergy syndrome, and really the be all end all of trying to really treat the stuff like I mentioned really is the allergy immunotherapy. The allergy shots is really the definitive way to really help. Like you mentioned, I have my practice in Brooklyn. I'm located in Flatbush. I'm available throughout the allergy season as things are going to start, kicking up. So, if anyone has any issues, not sure, how to treat their symptoms, want to find out what they're allergic to, we do the allergy skin prick testing. We send for blood. We do the allergy shots. So, if you're having any issues.
Yeah, absolutely. Everybody, thank you so much for joining us. Dr. Saadia, really thank you so much for being on here, giving us some insight into the world of allergies. You are here for the community. If in case anybody needs to get tested for allergies or treated for allergies, you can always reach out to your primary care doc for a referral, or they can contact your office directly. All right.
Okay.
All right. Thank you so much for being on here. I appreciate your time. All right.
Thank you for having me.
Oh, yeah. It was a pleasure. All the best, okay?
All right.
Thank you, everyone.
All right. Good night, everybody.
All right. Bye.